Okay, let's stop share. Sorry, guys. What is the next body system, guys? Anybody knows? Is that digestive or urinary? Carmen, you are unmuted.
Is it the urinary system, I believe, next?
So urinary system? All right. Yeah, we can go to urinary system now. Yeah.
Oh no, sorry, it was digestive.
Digestive. Okay.
I'm a little ahead. I'm sorry.
It's okay. So let's do a little bit overview, big picture about digestive system. Yeah. Oh, I can't draw from here. So I'm gonna stop share. I'm gonna click word here. All right, so let's see a very quick. Oh wait, I have to share. Oh, teacher, are you okay? I think so. Okay, we have our oral cavity here. And then we have our esophagus, right? And we have stomach, duodenum, jejunum, right? It's a very convoluted. Yeah, we don't know where they come from or where they go. So it's just a very big picture here. And we have appendix here. I'm going to change color probably. Okay, so we're going to have this in here. And we're going to have this convoluted, yeah. And we're going to have appendix. Maybe change the color here. Maybe orange. And we're going to have ascending colon. And then we're going to have transfer colon. Oh my goodness, look. Okay. All right, are we good? Can you guys? Okay, good. We can go a little bit more. So we start from this. What is this again? When we swallow food. You guys, can you guys see what I'm drawing? Where are you guys now? Okay. Oopsie. Can you guys give me a feedback? Are you able to? Let me see here. Snap left. Okay. Can you guys see the picture? Can anybody comment?
I'm not sure. Are you pointing to, is that the esophagus that you're pointing to, Mrs. Kyler?
Oh, but are you see the picture? No, when you swallow food, you put food into what?
Oh, pharynx.
The start. Oral cavity, right?
Oh, yeah.
Good. All right. And then, oh, you said oropharynx. So this is what the oropharynx right behind the oral, the posterior part. That's the oropharynx, right? Oop. Doesn't allow me, huh? Oh my goodness, where am I now? this is, bear with me guys, so challenging with this. Okay, so let's just do. Okay, so yes, this is the oropharynx. You guys can see what I'm seeing, right? How do I delete this? Where's the, okay, here. Yep. So now, since we're talking about pharynx, there's three part of pharynx. What are they? So this is your mouth, and then your nasal come in here, right? Nasal. So this is the nasal cavity. Yeah, this is the nasal cavity. Yeah. So right at the posterior part of your nasal cavity, what part of pharynx do you call? So in here, what part of pharynx? What is that called? And then we have three part of pharynx, right? Nasopharynx. Yeah, are we good? Are you guys there? Oh, nasopharynx. Yeah. So, and then also we have the third part of the pharynx, which is a different tract. We have respiratory tract from nasal cavity, right? And we have a digestive tract from oral cavity. So we also have that. It's kind of between both, yeah. Then we have what? Laryngo pharynx, which is in larynx, where your vocal cord is, where aphonia we talked about before happening. Are we good? Now, what is this, guys? This slide down here. This slide down, what is this? You saw? Are you guys there? Can somebody?
Yes.
Oh, okay.
Eric wrote yes.
Oh, okay. So what is this, guys? Your stomach. What is the medical term for your stomach? Thank you. Start with G. Six letters with the combining form. So
I don't know.
gas, gastric, yeah, gastric become adjective, gastro, yeah. Gaster, yeah, with combining form is gastro. Now we have a small intestine here.
Mm-hmm.
Consists of three. What are they?
Duodenum.
Awesome. Duodenum here, right? What's next? Start with J.
Yeah, Eric got him. Duodenum, jejunum, ileum.
Awesome, jejunum, ileum. Now, what's the difference ileum and ileum? You're gonna have later, yeah. So don't get confused with ileum. Yeah, what is that ileum? I think that's when we learn about skeletal system. Ileum together with Ileum, ischium, yeah. Hip bone, yes, Eric, good job. Part of the hip bone, yeah. Iliac crest, and then ischium is the, yes, hip bone. Good job. From the coccyx, yeah. Good. So this is the ileum, yeah. Remember, all of this we call iliac crest, yeah. And the sitting bone here, this is what the ischium is. Are we good? Yeah. And we have coccyx, yeah. We have vertebrae over there, yeah. So don't get confused, ileum and ileum, okay? Duodenum, jejunum, ileum. Now there is kind of like a transition between ileum into the ascending colon. What do you call? That is very important if you're a surgeon, right? Together with the appendix. So when someone has, you need to do appendectomy long time ago, long time ago, they have to do laparotomy. They cut the whole abdominal area. And then they grow, I think, starting 30 years ago, 40 years ago. Wait, how old I am? Yeah, maybe 30 years ago, 40 years ago, 35. We don't have to cut the whole. We just cut like a 1 inch, right, in the area of this. And when we got that, yeah, we got that transition, and then you can just, with your finger, you can just direct that outward, yeah, and then you clamp that appendix and you can cut it. So it's become very short procedures. It can be even done less than an hour or even 40 minutes, yeah, after you've done a lot. Are we good? So what's that called? The transition between ileum and ascending colon. Cecum, very good. It's a, you want to connect both name now? Yes, this is the cecum area. So they get into the cecum area of the colon, yeah? So you combine, that becomes ileo, yeah? From ileum, and from cecum, cecal, yeah? Ileocecal. Are we good? So there's combination of ileum and cecum. Good job, Eric. Good job. Awesome. That is so important when you do the operation appendectomy. So we just cut 1 inch, and then you get that ileocecal, and then you grab it with your finger because only 1 inch hole you have, right? And then protrude that out, and you will get, eventually after you protrude that out, you get that appendix showing. So this is appendix, yeah, which is also can be considered emergency operation when especially when there's a clinical signs or symptoms of they about to get burst. When they get burst and then they spread, surround the peritoneum inside the abdominal cavity, and get into the bloodstream and become septicemia, yeah, because it has germs. Any inflammation, germs easily come infected. So that could be life-threatening. All right. So you can do that procedures within minutes. Get that ileocecal, hook that with your finger, protrude that, and then clamp it and cut and clean it up and suture it back, and done. Yeah. But if it's already burst and then spread all over, then you have to clean up the whole peritoneal cavity. Are we good? So now we have that ascending, so that's a small intestines. And then next we have the large intestines, yeah? Now, large intestines consist of what? Start from proximal to distal. Go ahead, put in the chat. Where does it start, the large intestines? So we're doing proximal to distal, yeah? Go ahead, put in the chat. Are you guys there? Are you guys there? All right, we're gonna start from, oh yeah, there's one chat here. So we now talk about large intestines. Carmen, so where does it start from? So we already talked about small intestines. Good job, Eric. Cecum, colon, rectum, anal canal. Yeah, exit door for poop, yeah. So we already talked about duodenum, jejunum, ileum, small intestine. Now we talk about large intestine. We start from cecum is small part of the colon. So we start from the ascending colon. Yeah, you see that here, the ascending colon. Yeah, we start from ascending colon. Are we good? And we get to the transfer colon. So when people do colonoscopy, they will do from the anus, right, meatus, and then go, this is from distal to proximal. So then go to the descending colon, and then transfer colon, and all the way to the ascending colon. But we do, this is from proximal, yeah, proximal to distal. Are we good? Yeah. So ascending colon, right? So all of those food in the small intestine being absorbed into the bloodstream. Yeah, there's a lot of arcade there, bloodstream to start picking up that nutrients that we eat, and that is happening in the small intestine. And all the waste will go to the colon, the large intestines. Yeah, so we start from proximal distal, ascending colon, and transverse colon, right? Bzz, 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 right? And then go descending, ready. Once they kind of pile up there, and then they start give signal, hey, we are so much in here, and they start giving pressure, right? And then they open up the sphincter, interior sphincter in your rectum, anus, rectum, right? And then thank God you have an exterior sphincter. So you have two sphincter. The interior is kind of like a give pressure, and then you feel like you need to go poop, go defecate, right? And then thank God we have that exterior sphincter that, oh, wait a second, I'm taking Miss Kyler's, you know, quiz right now. I'm almost done. Okay, feces, hold on, hold tight. Yeah, I will go to the toilet soon, and then throw you into the swimming pool over there where you want to go, and then we flush you. Okay, that's what you want, right? But wait a second, give me maybe 10 seconds. I'm finishing up the quiz here. Because it's time, okay? And your body follow you, because that's control. That's a voluntary movement that you can control, yeah? But there's some stuff in your body that you cannot control. You cannot tell, hey, heart, stop beating right now. I'm tired thinking about you beating, doing every 0.8 second one cardiac cycle. Right? Can you stop? No, you cannot say that. You will die with that. Or your lungs stop, inspirate, expirate. All right? So, but thank God we have that external sphincter. And then we go descending colon, right? So this is when they do colonoscopy. Yeah, when it goes that far, that's what procedure of colonoscopy. Yeah, colonoscopy. Now, talking about colonoscopy, there's also after descending aorta, I'm gonna make a little bit longer this pipe here. Yeah. That's orange, right? So we have descending colon right there, right? Okay. And then we have in here, this is rectum, right? And this is sigmoid. And this is anus, the meatus, right? All right. So we have that talking about colonoscopy, right? We have sigmoidoscopy. Sigmoid, that becomes sigmoidoscopy. Okay, go ahead, put in the chat. What does oscopy mean? Go ahead, put in the chat. And then later we have rectum. When we just check the rectum, what is that called? What oscopy is that? All right, 2 questions. Even we can do oscopy on anus. Yeah, what oscopy is that? But first of all, what does oscopy mean? Go ahead, put in the chat. While you guys thinking about it, looking at textbooks, so every time you have my lecture, get textbook ready, because I always ask questions, yeah? Second A's in high school. Okay, guys, what does oscopy mean? All right, I see chat now. To view something with scope, yeah? Surgically, surgically creating a hole, that is ostomy, yeah? Sylvia, so creating a hole, that is ostomy, like colostomy, yeah? So Carmen is the closest. Yes, exactly. View something with a scope, or we call a visual examination. Using scope, yeah, exactly, Carmen, yeah. So we, it's kind of like very elastic tubing, and then there's a camera at the end, right? And then we insert from the anus, rectum, yeah, sigmoid, and then go to the descending colon if we go colonoscopy. There's a chat here. Yes. So if we're viewing the colon, we call colonoscopy. If we are viewing or do visual examination, and then it shows that in the little monitor, right? Because there's camera at the end as we insert, yeah. So poke the butt and then go inside. That's but if it's a rectum, what do you call? I'm gonna give you how many letters, yeah? Yeah, there's a 5 letters there. And this is 2 letters. Yes, go ahead. Virtual. Yeah, it's kind of like virtual field visit, right? Virtual viewing. Yes, you're going to see that in the camera because we cannot put ourselves small and then get in there, our own self. Yeah. So for the rectum, what do you call? Anybody? How do I add page? I think insert. Okay, I think I can do that. Anybody? Wait, where do I draw? Okay.
So for the anus, is that anoscopy?
Exactly. Anoscopy. Good. What about for rectum?
Rectum, I thought it was also sigmoidoscopy, but I guess not.
That's a sigmoid. Start with P. R. Proctoscopy. Yeah. Are we good? Any questions? I'm going to insert page here. Oh, they adding on the top, not in the bottom. How do I make more page here? Maybe I just put enter, right? Oh. Hmm. Oh, okay, there you go. Let's just keep doing enter. There you go, yoo-hoo. Got it. And we just put, doesn't have to be. All right, so go back to that again. So we have oral cavity, right? And then we have esophagus, and we have gastro, and then all of this convoluted, right? And then we have appendix here, and then we have ascending colon, right? We have transfer colon, and then we have descending colon, we have rectum, we have a sigmoid, rectum, and we have anus, right? Now, some examination. So we can do examination on the, we call upper GI. Yeah, so what kind of examination when we do upper GI? Maybe there's 2, the most common that being done to patient. What would that be? Anybody? What about barium swallow? So it's kind of like chalk, white liquid. You ask patient to swallow. As they're swallowing, you take picture X-ray, right? To see if something's if something kind of acid reflux. There's no way you can see that unless there's a change in the shape structure of the esophagus, gastro, and duodenum. Yeah, but if there's a tumor, yes, you can catch it. Yeah, because the X-ray will catch, you know, 3 colors. Yeah, and if there is a tumor, it can get catch. We also have the EGD, which is most people they call endoscopy. Yeah, so endoscopy is basically EGD. What does it stand for, EGD, guys? So the view is from here, here, and only as far as the duodenum. It doesn't go to jejunum ileum. Why? Because they're so convoluted. Yeah, we don't want to poke that and then puncture that eventually because we're not really sure the direction. Yeah, so it's very dangerous. So there's no way by doing oscopy on that. So what does it stand for, EGD? Just the name of these 3 body structure. So we start from esophagus, right? So what do you call? Eso, go ahead. Oh, there's a 4th chat here. Esophago, good, Carmen. Keep going. And then the G, gastro. And the D, duodenum, duodenoscopy. Yeah. So that's the real endoscopy. Yeah, EGD exam, esophageal. Some people say it esophageal gastroduodenoscopy. It's okay both ways. Are we good? Now the second one, yeah, the second one here, this is what we call lower GI, which we already talked about it, yeah? So when you guys do lower GI, right? Let me move a little bit up. So when you do lower GI, you can start, we can do barium enema. Oh, what happened? All of a sudden I get the B like heart. All right, barium enema. So we insert that barium. Again, it's kind of like a chalk, white chalk, milky, yeah, liquid. We kind of insert and we take picture, okay? Very uncomfortable. I haven't done it, but I've seen a lot. I've assisted and I don't like it. I hope I don't have to go through that. But anyway, if I have to, I have to. Anyway, so we already talked about it. Yeah, we can have colonoscopy here. If we want to go as far as colon ascending, we already talked about it. Also sigmoidoscopy, if we just want to go sigmoid. And by the way, the most colon cancer, it's happening around sigmoid, yeah? It could happen the other place, but the most common happen in the sigmoid area. So that's why other than colonoscopy, we have a specific just for the sigmoidoscopy. And then if we see some polyp in there, that polyp might turn into cancer. So that's exactly the same concept with the cervical cancer. It's just kind of like polyp or wart, yeah, and that can turn into cancer. So whenever you see polyp, when you become digestive doctor, right? Gastroenterologist, they call. You know, every time you have polyp, you need to clip it, take it, and then send to pathology to check whether that polyp is eventually a cancer cells. If you catch that early, the prognosis will be much better. Yeah, before they get bigger and then they get into the lymphatic stream, yeah, system, and also go to the blood stream, and that's gonna be a bad, worse prognosis. Yeah, we also have, we see that here already, proctoscopy, when it's just go as far as rectum, yeah, or endoscopy. All right, any questions, guys? No questions? Now remember, out of all the cancer, colon cancer, lung cancer, breast cancer, cervical cancer, yeah? So people kind of make a kind of like cross like this. So this is could be breast cancer for women, but also could be lung cancer, yeah? Used to be for men, but it gets more on women, yeah? It kind of, the paradigm changes since decades ago. And we have here, out of this reproductive system, yeah, we have a cervical cancer for the woman and prostate cancer for the men. All right, and also colon cancer. Those are the most common cancer that quite high number, yeah, of the causes of mortality in our country. All right, so that's just introduction, snapshot, big picture about, let me stop share. Am I stopping share? All right, about digestive system. Any questions? If there is no questions, we can jump into the practice. Eric, you like asking question, or Christian, Sylvia, Simin? Simin, I love your question when we talk about depression, and then can cause so many things happening, yeah? Carmen, do you have questions? So when is July 12th? So that will be next week, guys, huh? Your first presentation? Yes, next week, Monday. Yep. Okay, good, good, good. So now Wednesday, Thursday, we have tomorrow. Yes. All right, no question. Let's move on to the exercise. All right. Digestive system. Sylvia, Simin, do you want to take over the mouse? Let me know. Or are you guys shy? Go ahead, put in the chat. Oh, you're using your phone. That's fine. Simin? I didn't access to computer. That's fine. Let's do male. We have more female here, right? Carmen, go ahead. Take over, Carmen. Eric? Oh, Eric already did that. Okay, go ahead, Carmen. We love Carmen's enunciation. All right, go ahead, Carmen.
I'm trying, but I can't click on it for some reason.
Give me the mouse. Yeah, sometimes I have to check what you see. Yeah, see, you don't see what I see. Okay. So the keyword there, excessive swallowing and air. Yeah. So just combine them, you get the answer.
It should be aerophagia, excessive swallowing of air while eating or
Yeah.
drinking.
Phagia is swallowing. Yeah. Good job.
Okay. And anastomosis is a surgical connection between two hollow or tubular structures, the gallbladder and the liver, pancreas and the stomach, or the esophagus and the colon.
So mostly we talk about anastomosis also in the vascular system. So that's the hint.
So yeah, two hollow or tubular structures.
Right.
An abnormal accumulation of serous fluid in the peritoneal cavity is called peristalsis, dysphagia, jaundice, or ascites.
Yeah. That could be people with congestive heart failure. They get swollen in their legs and then go all the way up. And we need to suck that out. Yeah. Paracentesis. So it won't get into the lungs and patient might get respiratory failure and patient dies. So what is that? Good. That looks like also they call beer belly. Yeah.
Mhm. Okay, a cholecystectomy is a surgical removal of the trismus, volvulus, sigmoid colon, or the gallbladder.
For sure it's not colon. Yeah. And not the first two, right?
Mhm.
So colo is gallbladder. Oh, why did I tell you the answer? Jeez. My goodness, I was trying to just give a hint, but I gave the answer, so never mind. Oh, I have to be quiet.
A condition of physical wasting away due to the loss of weight and muscle mass that occurs in patients with diseases such as advanced cancer or AIDS is known as cachexia, cholera, hyperemesis, or proctopexy.
We see this a lot, people, malnourished people also, yeah. They don't have enough food and eventually the body will take the source of sugar from the muscle, yeah, wasting. There's a chat there, I couldn't read that, so yeah, cachexia. Yeah, in the famine place, country. I've seen that a lot when I work for UNICEF World Vision. So we had to do IV food feeding. Yeah, so it's really quite complex treatment. Some successful, some not. If it's too late, yeah, it's really sad. Only because not enough food, people die. So sad.
The presence of gallstones in the gallbladder or bile ducts is called dyspepsia, cholelithiasis, hepatitis, or ulcerative colitis.
Anybody can give an idea also? Yes, lithiasis means stones. Yeah, good.
The word dysphagia refers to difficulty digesting, vomiting, chewing, or swallowing. Dys was difficult, and then phagia was swallowing.
Now, what do you call chewing? What is the medical term of chewing?
Mastication.
Yes, to masticate. Yay, good job. Awesome.
Pain or discomfort in digestion, commonly known as indigestion, is also called irritation, emesis, dyspepsia, or dysphagia.
Good job. Yeah. Dyspepsia. There's two chats. I couldn't see that. So anybody can check what's that two chat.
Yeah, Sylvia got it right. Good job. She wrote the third one. Which of the following is an endoscopic procedure that allows direct visualization of the upper GI tract? The esophagogastroduodenoscopy, gastroduodenostomy, gastroduodenoscopy, or gastrotomy.
Yeah, that's what we talked about. Yeah.
Mm-hmm.
Okay. Got it.
Okay. Hematemesis is the vomiting of bile, undigested nutrients, blood, or water.
So emesis is throw up. Hemato is what?
Good job, Sylvia. Blood. Okay, the partial or complete blockage of the smaller large intestine is called melena, ileus, trismus, or botulism. Any ideas, anyone?
For my cell phone.
I don't know if it's botulism. Let's see. It's not trismus. Well, we can try. I feel like I should know this. Ileus. We just talked about that.
Yeah. So melena is when you poop blood. Yeah. Hematemesis, melena. Yeah. Or melena. So there's a ileum, ileum, ileus. Yeah. Remember those three words and the differences.
All right. Surgical repair of a cleft palate or cleft lip is called proctopexy, cholecystectomy, cholecystectomy, or palatoplasty. We know surgical repair ends in plasty, and that's the only one. Good job, Sylvia.
Yay.
And the palate, the palato. All right, the passage of stools with the black tar-like appearance caused by the presence of digested blood is called melena, ulcerative colitis, or cholangitis. And we just went over that. melena. Okay, the lack of adequate saliva due to diminished secretions by the salivary glands is called stomatoragia, xerostomia, regurgitation, or cholangitis. Yep, xerostomia.
So what do you call dry eyes? So dry mouth, xerostomia. So some people with, there's a disease called Sjogren disease. It's kind of autoimmune. So early clinical symptoms is xerostomia. This is dry mouth, right? And dry eyes. Now, what is that called, dry eyes? All right, what's that called, dry eyes? Now, Sjogren, sometimes they're friend with rheumatoid arthritis and lupus. Yeah, those three disease, many times they are partnered. Yeah, in a patient. Just like chlamydia and gonorrhea, for some reason they're partnering also. Yeah, so amazing to learn the character of the germs or disease. Yeah. So what do you call dry eyes? So you just combine them, combine the prefix of dry. What is that, dry? For the, so prefix dry means dry. What is that? Zero, right? See that? Stoma is mouth, right? And ia is pertaining to. So xerostomia, yeah, it's a dry mouth. So if you want to say dry eyes, so we just add zero and eyes. Yes, Sylvia, good job. So zero, yeah, ophthalmo, yeah, xerostomia. Are we good? All right, so even when we don't understand what it means, we got it. Okay. All right, continue, Carmen. So finish it up and then we can continue tomorrow, the next. Yeah.
Okay. So let's see. Last. Okay. The endoscopic examination of the interior of the rectum, sigmoid colon, and possibly a portion of the descending colon is called esophagastroduodenoscopy, sigmoidoscopy, colonoscopy, or salmonellosis.
Now, when we do the sigmoid, eventually we will do also rectum and anus, right? But we can also do separately, just rectum, don't go all the way to sigmoid. Good job. Yeah. Sigmoidoscopy. I think that's what your question, Carmen. Isn't that all sigmoidoscopy, right? So if we go sigmoid, eventually the distal part also get examined, right? But we can go just specific rectum, yeah, proctoscopy, or just specific anus, yeah, anoscopy. Good job, especially people with hemorrhoid, right? All right, so it's already 11:19. Isn't it class until 11:20? I need to get ready to go to campus, go grab my lunch, because there's no food available in campus. It still look a ghost town, so it's just very limited classes. So I have to stop by I always take my sons. They are staying at the hotel all day today. So any question from anybody about anything? No questions? Simin, if you can present tomorrow would be nice. But if you're still busy, that's fine. We can always have anticipation skills of doing everything. Yeah. Carmen, do you have questions? So how is school going? I mean, I think you're taking it at in fall, right? That means you're moving up north.
We'll see. So the application process is my job right now.
Yeah.
I'm like 3/4 there, and it's due in September. So we'll see. Yeah, we'll see where I move. I
Yeah.
did some a couple on the East Coast, a couple in the Caribbean, a couple in California. So we'll see what happens.
One day at a time. Yeah. Eventually, we will move forward. Good job, Eric. I didn't access to computer. Okay, didn't access. So what are you doing, Simon? You do cell phone? Yeah, you can email me personally if you have something. Yeah. Christian, how is school going? Tablet. Oh, okay. Christian, you are taking your PA program, right? It sounds like you are EMT or paramedic or what? And Eric, you are taking a doctorate of osteopathic. Sylvia, Simin, you guys go PA or something like that. All right, guys. Have a good day. Yeah, and enjoy finishing up this study. The knowledge is really will set you free and then will give you prosperity. Yeah, in many ways, intellectually, financially. Yeah, and I pray that each of you will be successful. Continue our generation. I will die and you will guys go grow and having your kids, having grandkids. Yeah. All right, bye guys. Have a good one. Adios, amigos, amigas. Auf Wiedersehen und vielen Dank. Arigato. Yeah. Sayonara. Bye.